If you want to know three things to consider before recommending surgery for athletes, you need to tune into this episode. Welcome, all new listeners, and welcome back to those who have heard my content in the past. I'm excited to talk about surgery and what you can recommend for your athletes. But before I do that, what is happening in life? What is new? What's the positive focus? What's happening? For those who have been long term podcast listeners, it has been a whirlwind. Everything from my last episode where I mentioned, my clinic, one of my clinics flooded. I recently just had a one of my teeth, like I had a crown on my one of my teeth and it cracked. So I am navigating that. I've had challenging, patient cases. I am like including new services inside my clinic. I have a new course that's being created. There is a ton of stuff, and it makes me so happy because I flourish inside the chaos. My kids are fantastic. My son Zach, he said something to me the other day. He said, Chris, Dad, Dad, I want to start a business." And I was like, "Excuse me?" He's like, "Yeah, Dad. I want to be like you." And I was like, son, you don't have to start a business to be like Dad. I really just want you to really enjoy what you do." And I really had to reflect on that. When I mentor all my physical therapists, I mentor individuals and private practice owners. I realize, the goal is to be happy. And when I see my son, and I really don't want him to follow my footsteps if that's not what he's enjoying. And to me, that was amazing to just hear his feedback. And like he wants to be like his dad, and that's such an amazing feeling for those who are parents on this. And you listen to this, it's like one of the most rewarding things on the planet, because you live and breathe through being an example. And when you see that happening in life, you just it's a little teary-eyed moment. But he's great. So Zach also started lacrosse this week, which is fun to watch. I've never played. For those lacrosse players out there, that's a tough sport. My daughter is doing fantastic, doubling up on gymnastics, and my son Jacob is trying to be like his siblings and just keep up with them. So all's good in this world. A bunch of chaos. Family is fantastic. Let's move on to this episode. So let me tell you why I'm talking about this today. I had, between my tooth cracking, to mentoring a PT on my team about a condition and surgery considerations, to another mentor session with somebody I work with in New Jersey. All of these cases came together, and they were about surgery, and it's about these three considerations I'm going to share with you. So if you've struggled to work with athletes or patients, and you're like, "Man, they really need surgery," or "Is this the right recommendation?" This episode is going to help you outline three things to consider anytime that you recommend something to an athlete and you're saying the word surgery. You need to use these three considerations. It'll help you feel confident about that and offload the responsibility off of your shoulder and onto the patient, so they can make the best decision for yourself and take that pressure off of you. So if you're a PT and you find yourself in these situations, this episode is absolutely perfect for you. All right. Let's talk about a couple of the different cases. So we had a case with a patient who has some hand issues. And if you ever worked with, let's say, a spinal cord injury, let's say a higher level spinal cord injury, and they use kind of active insufficiency to help them with certain things. And for instance, say somebody has a condition where they can't extend their wrists, they can't use their extensors, but they have their flexors. And so when you have somebody who can use flexors, when they're in a shortened position, when their wrists are, flexed or whatever it is, they can grip. But the minute that they put themselves into extension, their flexors just passively turn into finger flexion. Now, this individual during this case had an injury, or had some deformities where they're having now contractures with their finger flexors. And the consideration that surgeons have made is, what if What if we have a flexor tendon release, right? So this person has flexor tendon contractures and they want to release those. Now, the consideration that we discussed, and I simply asked, well, how much extension do they have actively? And it turns out that they don't have any whatsoever. Now, they have extension at the brachioradialis, like the meat of it, but they don't have any finger extension. Also, they have some other deformities, swan neck deformities, all these other things. But it came down to, all right, this person's a high surgical candidate. They're having significant impairments in their life. They've been to 3 or 4 different surgeons to consider, is this the right thing to do for me? And it's a big tough question as a provider, as a physical therapist. You put yourself in a position where you're like, well, gosh, they look for your input. Now they're going to Google, they're going to spend their time with family members, they're going to be asking friends, they're going to be doing these, but your opinion weighs heavily. And that puts a lot of pressure on you. And so you have to kind of put this in the context. All right, so how do I give this person the best case scenario? And I'm going to outline 3 things, but I want to share this story. So, one of the first things we considered was, okay, if they don't have the surgery, what happens, right? So now they have finger flexion contracture. They can't actively, move their wrist. Now that is like that has to deal with feeding. That has to do with quality of life, opening doors, opening jars, and they lose their independence. They lose their mobility. And that's just one aspect. Okay. So their quality of life is impaired to a certain extent. But now, if we do a flexor tendon release, what happens with the flexor tendon? So if we release the flexors, so they no longer have as much active flexion, now they're floating with less flexion. Now, if they don't have extension, neuromuscular control or strength, what happens to that hand? It's kind of floppy, and you don't have muscle flexors now to flex it, and you don't have extensors to extend it. So now it's just kind of floating in the air. Now, this is a unique scenario, but like, what would you do on this? I mean, if this was your aunt, your uncle, your grandma, your grandparent, what do you do on this? Basically, it came down to what's the quality of life that you want? Do you want to struggle now, or do you want the potential risk of, I don't even know if this is going to work? And now, as you can imagine, surgeons have a high pressure at this point. What do you do with this? That was one case. Number two was my tooth. All right. So my tooth, I had a crown placed, I don't know, 15 years ago, 10 years ago on one of my molars, one of my teeth. And I was eating pizza the other night with my kids, and I took a bite and I heard a crack. And I looked at the crust. I was like, there's no way this crust is that crispy. I was really like consider I didn't even know what was happening. I couldn't process it. So I bit down and I felt a crunch. I was like, that's weird. I bit another one and I just heard more crumbling. I'm like, oh my gosh. So I threw out the pizza and I find my tooth, my crown had just basically just uh, disassembled, crumbled under pressure. And so I took it out and I didn't know what the next step was. So it was Friday night. I called dentist. Everyone's closed on Saturday. So I basically didn't eat with my right side. I only ate with my left. So now I started like now my left muscular like cheek is now sore because I'm eating all with my left. So on Monday, I call a dentist. I'm like, hey, I need your input. What do I do here? One dentist said, hey, you have to remove your entire tooth. You have to extract it completely, and then we're going to backfill with all these other things. I was like, wow, that sounds like a very invasive surgery. What do I do with this? And then I called another dentist. I said, "Hey, what do you have?" And they're like, "Hey, these are the options. We actually don't have to extract your tooth. We can do something else." I said, "That sounds like a better option." And both of these, the case of the complex hand and my personal tooth case, made me realize and made me think about all the other surgical candidates that I've helped before in the past. Basically, it got me understanding there's fundamental foundational questions or ways you can approach these things so that way you can appreciate how to work with people and take that pressure off of you. And I wanted to share that after years of doing these conversations with patients and being able to help people, I wanted to share what that foundation is and how I approach that and how you can do it inside your care to be able to do this. So here they are. Number one. What you're going to consider is what is the goal with this procedure or surgery? Is it function or pain? Those are two different things. I know we compartmentalize them into one thing, but the reality is this is a scenario where you have to determine: are you looking for pain relief or are you looking for functional improvement? Because in the hand scenario, pain is not the consideration; it's a functional challenge. And in my case, with my tooth, it's a functional challenge. For some people, it's pain management. And now what you have to ask yourself and work through in an algorithm is: how much pain do you expect to be alleviated with this procedure? That's the question for the surgeon. And then you have to qualify that patient and say, how much is enough for you to consider doing the surgery? If they say, hey, it's going to be 50% improvement in back pain, neck pain, shoulder pain, is that enough for you to qualify that? And most people don't think like that. That's not something they process. They hope that this is going to remove their pain completely. And I think that's a very fair question you have to ask and have with them. It might not take away 100% pain, and you got to be okay with that, because there's going to be scar tissue. There's going to be other things that we don't consider, and that discussion has to come up. Now, if they're looking for functional improvements, what's the amount of functional improvement you're looking for? What's the degree and what's enough? Because then that allows that patient to really have the expectations. Expectations for surgery is life. It is everything. The more someone is expecting something, and they're more okay with if it doesn't go right or if it goes wrong. And I'll tell you the questions I ask my dentist to be able to do this. But it's the question I will ask on the front end: what is it that you expect? What degree of pain improvement or what degree of functional improvement are okay? And would you consider, where's the threshold where you wouldn't? And for some people, they might back out of that surgery, and all you've done is prevented a potential or delayed the potential inevitable. Now, that's okay, but what's your role? Your role is to provide people with support and feedback so they can make a better decision for yourself. So, number one, ask: what's the degree of pain or functional improvement that you would expect or want? The next one you have to ask is: what's the 5-year outcome that you want now or expect? Now, you might say, I want pain relief, all these other things. What's the 5-year prognosis? Um, because now that might change something. Or if they're like, oh, it's just going to last you a year, some patients might be like, oh, then what are my other options? It forces that patient and you to ask bigger, better, deeper questions to allow somebody to be more successful and make a better decision for themselves. So in the case of my tooth, the short term is, if I do one procedure that does basically a cap to put it on top and salvage it, that lasts me about 10, 15 years. That's my prognosis. Before that, the mechanics or the physics won't allow it to hold anymore. Now, my 30, 40, 50-year plus prognosis with replacing it, digging it, and completely putting an artificial one in there, that's the best long-term prognosis. So now I have to make a decision on what is my decision going to be? What type of prognosis do I want? Do I functional improvement? Yes. Now, for how long? Do you want like a 10 or 15 year, or do you want a lifetime? That is a fantastic question. Now, these are the conversations I had with my dentist this morning. So those two questions are big. They just, now you have some tools in your toolbox. Okay, I'm considering surgery. Perfect. Are you looking at for pain relief or functional improvement? And what degree would be the minimum for you to consider moving forward? Number two, what's the 5-year prognosis? That's a good question for the surgeon. And what's the 10, 15-year prognosis, so they can make an informed decision and understand, ooh, that's the path I want, or I wanted better. So that's number two. And last but not least, number three is, this is a tough one. And I like to ask this to all my patients and to all the physical therapists that I mentor. What would you do if this was your family, your spouse, your wife, your husband, your friend, your family, your colleague, your uncle, your aunt? What recommendation would you make to them? That's a tough question, because you usually don't treat your patients that way. Why not, is my question. um, that changes your approach, because now you're going to take off your type A, OCD, PT brain who's very analytical and logical and scientific, and that's fantastic. But now you're dealing with somebody's life. Now, you might say, hey, the research says, I understand, but would you do it? And now that changes the game because now you add emotion into your decision making. You're very used to a logical approach. If they're at 12 weeks, this is the stimulus I provide, this much progression, this over time. You're going to go step up, step down, plyos, blah, blah, blah. That allows you to move in a very logical fashion. The difference now is you have emotion tied to it. Once you have emotion tied to any decision, it makes it more difficult because you have subjective components to this. So, it's easy for you as a physical therapist to rely on research and be very, very analytical. However, let's take the human side of you because I know it exists behind that shell. You are an incredible human. It's just masked by a white coat of a physical therapist who blocks your ability to make good decisions and help people genuinely because you're afraid to shut it down. You're afraid to make emotional support, emotional decisions. Rightfully so. It got you to this point in your career, but when you talk about humans and they're about to make a life decision on, is this the best decision for me? You have to have that element. You have to have both. You can't be too emotional because then you have no logic. You can't be too logical because you're a robot. You have to have a little bit of both. So let me put this in context. My dentist was offering me my decisions, my options. I said, "What would you do if I was your uncle, aunt, um, grandfather?" And he did the same thing. He was like, "Oh." I said, "That's fair because this is exactly how I would approach a patient." And ultimately, he said, "Chris, um, I truly believe that the short-term prognosis is probably better for you, given your scenario." And I said, "You know what? I trust you. That's all I want to hear. I'm doing that." Because now I take the logic side of it. Here's the structure, here's the physics, here's what would happen to my tooth. And then I said, what would you do if it was your tooth? And he had to think about that and make that decision. And to me, those three things help you make the best informed decision. And that's all you can do for your patients. You can do all the research in the world. Then, when turned around, what if it was you? What would you do? And you'd be like, I wouldn't do it. Then why don't you relay that information? That allows you your human side to come out, share it with them, and that creates relationships and outcomes that will last a lifetime. Patients are looking for the logical side 100%, but more than anything else, they're scared. They're emotional. They're not thinking logically. So you have you who is 100% logical, robotic, and doesn't want to share your feelings with patients and be genuine because that's how medicine is. And you have patients who have a huge emotion, has Googled stuff but created more emotion. And they have a super logical human with a super emotional human. Those don't mesh. You kind of have to do both. Present the 5-year prognosis, logic, present functional and pain improvements and what's the minimum they would do. That gives them logic. And now you provide a little bit of emotional support on what would you do if this was yours, your family, everything else. Those two combined, you're now a little bit of emotion with logic, and now they're high emotion with a little bit of logic. That combined helps people make the best decisions. And you can go home sleeping about it, thinking about, I made the best decision possible. I feel good about that. And that's the problem that you have as a healthcare provider. You take things home because all the pressure's on you. Why is it on you? Because you've allowed it to. This is the way you genuinely offload it into the patient and allow them to make the best decision possible so you can sleep good at night and feel good about the decisions that you make. Ultimately, we're all trying to do the same thing. We want to create amazing outcome in people's lives. Sometimes we're presented with tricky situations like a flexor tendon release that maybe is not ideal, maybe it's going to help, but you go through those three scenarios. Maybe you run into a friend or somebody who's cracked a tooth and they don't know, and there's two different options. Which one would you do? You ask those three questions: functional or pain improvement. What's the minimum that you would do? Ultimately, what's the 5, 10 year prognosis? What would you do? And what are those options? And number three, what would you do if this was your friend or your family? Between those three, those are the only three things that you really need to consider. And now you do all your Googling, your YouTubing, all those things that allow you to make the best decision possible. But ultimately, you have to be You have to be a good human, a good healthcare provider, and be genuine about that. And that allows you to sleep better at night and really feel good about the prognosis and everything you're going to do. And when you see them afterwards, you're like, do you feel like you made the best decision? And they'll happily tell you and be honest and be like, but you knew everything going in. You knew the risks, and you can't be unhappy about that. You made that decision. It just it allows people to make the best informed decision, whether that takes them a year or 5 years. It's the number one thing that has helped me the most to improve my outcomes, believe it or not. Because if I'm seeing somebody pre-op and I've laid out this outline, they knew that going in, so now their expectations were met or exceeded or whatever it is, and so now my rehab matches what we delivered, and now we know what, if I don't know I'm only gonna get 70% improvement, but we knew that going in, now I look like a great provider. I look like a person who's done my job, and I will always get somebody who's like, they're gonna refer their friends, their family, their mom, their grandma, their sister, because that's all they're looking for. Think about anybody. If you had a cracked tooth, what would you do? You go to all the resources, figure it out, but you still come down to, shoot, what decision do I make? And that's the human element. That's the question that no one can overcome but you or that patient. And all you're doing is giving people the tools to make that decision a little easier, a little bit more effective. And it allows them to just ensure that they're in the right place at the right time. I've probably been presented with thousands of post surgical complex cases, and this week, today actually, I was put in the position, what would you do? And so I am going to move with the shorter term prognosis on my teeth. Wish me luck. But I feel good about the scenario. I feel good about my decision based on the scenarios that I've done. And it's very healthy to go through these scenarios and be the patient on this side. So it's been fun, um, and allows me to really see it as a provider and as a patient, and improve my quality of care. So I hope that helps wherever you are in your career, whether you're a new grad or a student or a 20-year veteran. You've always been perplexed with these type of scenarios in your life, whether that's your own surgeries, your own injuries, and now you're putting in context just to make that a little simpler. So I hope your life is amazing. People have been asking me, "Hey, Chris, what's your next course?" I haven't released it yet. There's been a lot of things going on. So for those who are interested in attending, I've had two people already sign up. I released it under the radar. I apologize, but people have been asking. So there's a couple of upgrades to what we're doing. Last year I did my accelerator, and this year I'm actually hosting my strength and conditioning summit first. There's a lot behind that, but basically the interest was higher to be able to do my strength and conditioning summit. So if you've never been to my summit before, you can go to Dr. Chris Garcia, excuse me, drchrisgarcia.com/summit. This is a strength and conditioning summit to give you a framework on how to improve your skills and confidence with strength and conditioning. For the first year ever, whenever you're listening to this is February of 2024. Whenever you're listening to this, this is the first time I'm opening it to all healthcare and fitness professionals. So this is going to be a mixture. My vision and dream is to have education that helps align and gain a bigger collaboration between athletic trainers, physical therapists, massage therapists, chiropractors, physicians, PAs. I've worked in professional sports, so I've seen what that team can do, and it can do significant damage in the best way possible. And I want to bring that to communities. I want to bring a central source of education that helps align everyone. So, strength and conditioning is a big one. This one helps align athletic trainers who have athletes going back to sport. Maybe you're the physical therapist who collaborated with them and they're going back to sport and you want to communicate with them, or you work with personal trainers or strength coaches and you're sending them back to the gym, or they're in the gym and they're hurt, or you're a fitness professional and you want to be able to work with more physical therapists, or you want to help with, rehab or prehab inside your programs. I'm here to align everyone, and so I'm including for the first year all healthcare and fitness professionals. I've got a little twist that will be released in the near future. I'm just locking some things down, but it'll be in San Diego. There will be a virtual option. So for those who are attending virtually, you have access to the modules afterwards. This year, we're adding force plates and force plate data to help you understand how metrics and force production can help simplify your strength and conditioning program. How to say, well, I've never done it before, but if I just did some testing, it'll tell you if somebody's very springy and needs strength, or somebody is strong but not springy and they need a lot of plyometrics, so you don't waste your time. It'll make it more efficient for you. So there's a lot of good things inside this strength and conditioning summit. So if you want to be able to collaborate with other providers, you're a fitness professional, want more foundation in that, you're a healthcare provider, want more background in that, or you're between the two and you want to just lock it in and improve your ability to connect with people, or you're just literally looking for more pearls on how to improve your strength and conditioning, this course is perfect for you. So I'm excited to see you inside the course. That'll be May 18th and 19th of 2024, Saturday and Sunday in San Diego. Now, if we have too many registrants, there's two options. I might open it up to more virtual, or if you really twist my arm, we will open up to a bigger venue. I don't have that planned, but I'm already seeing with two people registering before we even launch the course. It kind of gets me excited slash scared. So if that's for you, I'm excited to see you there. It's at drchrisgarcia.com/summit. Other than that, I will see you guys on the next episode. Take care.